Hello. Let's talk about full mouth reconstruction. I'm not showing you the technique for all tooth preparation, impressions, things like that. I'm going to show you the basics and the before and after. So what is a full mouth reconstruction? That means like you're restoring a car. If you were driving a car to California or Alaska from Texas, what part of the car would you want to work? All of it. You'd want the whole car to work. And so a full mouth reconstruction means restoring all the teeth. The teeth may be broken down, they may have large fillings in the teeth, they may have cracked teeth, there may be missing teeth. The incisal or the occlusal plane may be distorted. You may want to correct that. So it means fixing the car so it's back in optimum condition. Fixing the teeth, the dentition, so they're in optimum condition or as good as you can make it based on the hand you're dealt, based on the presenting situation. So I'm going to go through several cases that I have restored the full mouth. This gentleman had some bad habits, a lot of decayed teeth. He was told, he was from a town in another state, and he was told by his dentist he was going to have to lose all of his teeth. And his mother freaked out and said, he can't lose all his teeth, he's only 25. And so this dentist had been to a seminar I'd given, several seminars I'd given. He said, there's this dentist in Texas that might be able to fix his teeth. You might want to go down and see him. So they flew down here, and I said, you know, I can fix anything almost if you want to have it fixed. So he had lots of decay between all the back teeth. So the first thing I had to do was move the gums up on the upper teeth and down on the lower teeth. This is called a crown lengthening. And in this procedure, you have to change the alveolar crest as well as the gum line, because you want the bone line to be 3 millimeters from the gum line. If you just remove gum, that's called a gingivectomy. Then if it's not 3 millimeters from the alveolar crest, the gingiva will grow back over your restorations and you'll have inflamed, red, bleeding gums. So this is after a week of healing, and this is the final restoration. You can see how healthy the gums look. So I've actually moved the bone level up and the gum level up. So those are veneers on his anterior teeth, crowns on the posterior teeth. Had to do some endodontics on some teeth, but we didn't lose any teeth. So this would be an example of a full mouth reconstruction. We're restoring all the teeth that have issues, and in many of these cases it involved all the teeth. This gentleman had spaces between his teeth, worn teeth, chipped teeth, and he'd gone his whole life and didn't like his teeth. And he said, I'm at a stage of life, I want to fix them. I want to have attractive, functional teeth. You can see chipped up, had a lot of bonding, spaces in here. So in this case, we had to do a little clear correct orthodontic tray, orthodontics first, because the key is you want the spaces between the teeth to either be minimized or be wide enough that you can place an artificial tooth in there, or a pontic or an implant. So I either want the teeth to be close enough together that you can restore them with a crown or a veneer, or wide enough apart, the space to be large enough that you can put an entire tooth in that space and it looks natural. See, same thing, I'd like to get the teeth closer together here so I can just place a single restoration on this tooth and not have to place a bridge in that space. Same thing here. I'd like to get these teeth a little closer together and open these spaces, have them open enough that you can put a full tooth in those spaces and it looks natural. Close that space a little bit so you don't have big fat teeth on these adjacent teeth. Same thing down here. This is not so bad. You know, a little closing right here. Get those teeth closer together, because you don't want a giant, wide, fat tooth on these two teeth and these other teeth looking normal. So this is him after we finished. He wanted more of a natural shade, which a lot of men do. They don't want toilet bowl white. They don't want to stand out. They just want attractive teeth. So we've placed a combination of implants and fixed bridges, closed the spaces. I like gold crowns on second molar teeth. You can't see them, and you don't have to worry about them ever breaking. Any tooth-colored restoration, including zirconium, can be broken if you bite down on a rock or a bone in a bite. And watch my video on how to keep your teeth for a lifetime, and I talk about chewing. So these have all been filled in, all the spaces, implants, and some bridges, veneers on the anterior teeth, crowns on the posterior teeth, veneers on these lower anterior teeth, crowns on the back teeth. Incisal edge was corrected. Must have a night guard. So this is him before and after, before and after, before and after. And I do a lot of these cases. Every morning I see one case from 8 in the morning until 1 or 2 in the afternoon. They're sedated intravenously with Versed and maybe some Demerol. And so you can get a lot of work done at one time. Before and after. Close the spaces with fixed bridges and implants. Same thing over here. Another woman, the thing that pushed her to action was she broke that tooth, snapped it off at the gum line. She'd had crowns placed on several of the teeth and wanted to restore her whole mouth. She wanted a beautiful smile and healthy teeth. So you can see kind of a Heinz 57 of natural teeth here that are yellow and abfracted, missing teeth down here, some old crowns on some back teeth. We're going to lose that tooth and replace that with an implant. We're going to place implants here. You can watch my video on implants versus fixed bridges. Sometimes I'd rather place a fixed bridge. Sometimes an implant's the appropriate restoration. Well, this is her after we finished. This is her. So we've got an implant here, crowns to replace these crowns, crowns on the back teeth. See, this is a high water crown. This is supragingival because you can't see this part of the tooth. That's not decay. But I don't want to remove this tooth structure to take the crown all the way down to the gum line. Sometimes, or it's usually optimum if a tooth is not in the aesthetic zone to place a supragingival margin because it's easier to keep clean. These are implants over here, implants down here, an implant here, crowns, veneers on the other teeth. This is taken in a mirror. So we placed implants, replaced the crowns on the back teeth, veneers on the lower teeth, crowns here, crowns on the upper teeth. These are the implants, implant. These are all tooth-colored restorations. They're either lithium disilicate, Emax, or if it was a fixed bridge, we use a zirconium core or understructure and lithium disilicate, Emax veneer. The veneers and the full crowns are lithium disilicate or Emax. I'll talk more about bridges versus implants in another video. In the anterior, it has a lot to do with the lip line. If it's a low lip line, I'm happy to go with an implant. If it's a high lip line and the patient shows a lot of gum tissue, then oftentimes I'd rather go with a fixed bridge because you can control the gum line better with a fixed bridge than you can with an implant in the aesthetic zone. This lady just had some old crowns on her teeth, didn't like the darkness on the lower teeth, some old filling, some abfraction, old crowns, dark porcelain to metal crowns on the upper teeth, chipped teeth down here. And we actually did a full mouth reconstruction on this lady and on her husband. As you can see, had some old crowns, had some endo through this crown, old crowns on the bottom, worn, porcelain to metal. And so now, rarely, I can't remember the last time, do I use a porcelain to metal crown. I may use gold crowns on second molars or gold onlays. And I may do some gold inlays, but I rarely use porcelain to metal. I primarily use lithium disilicate or Emax full crowns, or if it's a bridge, I'll use a zirconium substructure and a lithium disilicate / Emax veneer over the substructure. This is her after we're finished. Replace the crowns on the maxillary anterior teeth, veneers on the lower anterior teeth, crowns on the posterior teeth. This is her before and after. This is another case. Had a lot of decay on the teeth, a lot of decay, and thought he was going to lose all of his teeth. His mom brought him in too. Mothers are the ones that save us all, aren't they? And she said, "Can you fix his teeth?" And I said, "I can." You can see just decay everywhere. And we could save all the teeth with endodontics and crowns. This is before and after. Crowns and endo on these teeth, veneers on the anterior teeth, little bonding on the incisal ledges of the lower teeth. That's the Dental Minute. These techniques work, and they work every time.
It's time. It is time to take your dentistry practice to the next level, and you know it. You just haven't known how to do it until right now. That's where dentistrymasterclasses.com steps in. At dentistrymasterclasses.com, Dr. Cutbirth is offering you his greatest work and his best cases. Here's everything that you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos and Dentistry Masterclasses comprehensive cases for study and reference, and you're going to get before and after photos of Dr. Cutbirth's fantastic restored work. So, great deal. $40, that is it. For $40, you're gonna get all of this. So go right now to dentistrymasterclasses.com and subscribe today and change your life, change your practice.